Everyone, my name is Sara Siddiqi, and I'm a PhD student in epidemiology, supervised by Dr. Jessica Dorix and Dr. Ian Coleman. Today, I'm going to be presenting to you a study I completed for a class project. Earlier this year, the project was titled Eating Disorders Among International Migrants, a Systematic Review and Meta-Analysis. A little bit of background. Migrants are exposed to stressors that can affect their physical and mental health. This is hypothesized that it could be due to factors such as diet and food availability. Recent statistics have shown that there are approximately 281 million international migrants worldwide. Previous research has looked at the impact of migration on depression, anxiety, and schizophrenia, but research is lacking specifically related to eating disorders. As such, we investigated whether there is a difference in the prevalence of eating disorders among migrant and local populations. To do this, we used a systematic review and searched Medline, Embase, PsycInfo, and Web of Science. All articles were screened in Covidence, and NIH quality assessment tool for observational cohort and cross-sectional studies was used to assess risk of bias. We followed the PRISMA guidelines. Eligibility criteria identified that all studies from all backgrounds were included. However, we excluded clinical populations. Studies were excluded if they were based on migrants that were internal migrants. So, for example, individuals migrating from one province to another in the same country. Studies were only included if they had a comparator population, so a native population to the destination country. They were included where eating disorder assessment was based on diagnostic criteria from the DSM, the ICD, or based on validated screening assessment reports. And finally, we included only cross-sectional, cohort, and case control observational studies. Here's the flowchart of results for our search. We identified 1,504 records from the databases. And then going through abstract screening and full text screening, we identified 9 studies that should be included for data extraction. And then we went through the reference list of these 9 studies and identified 1 additional study. And as such, our final review included 10 studies. From this, only 6 had data that was available to be included in the meta-analysis, and the remaining studies were summarized using a narrative synthesis. Here are the results from a random forest meta-analysis. Based on subgroup of the instrument of assessment used for eating disorders. So here you can see some studies that use the ICD-10 diagnostic criteria. Here are some that use the SCOFF, which is a risk assessment tool, and then the remaining were grouped together in an other category. I should mention, I said there were 6 studies available for meta-analysis, and this plot shows 7, and that's because the study by Mustelin et al. In 2017 actually had data for 2 different countries, and so we included those as separate data points. This subgroup was actually significant. And we found in the studies using the SCOFF questionnaire had an increase in the prevalence odds of eating disorders in migrant populations compared to the local. And when we did a sensitivity analysis and removed these studies, there was actually, in the remaining studies, a decrease in the prevalence in migrant populations. What's interesting is that the studies that used the SCOFF were actually based on populations that only had children or youth. And so when we did a subgroup analysis based on age, we found that in the studies that used only adult populations, there was a decrease in the prevalence of eating disorders in migrant populations. And those 2 results kind of go hand in hand. Overall, when we did into subgroup analysis, we found no difference in the prevalence odds of eating disorders in migrant populations compared to local populations. However, when we looked specifically in non-SCOFF related studies and studies that had adult populations, we saw a decrease in the prevalence. And this goes in line with the healthy immigrant effect, which is hypothesized that individuals who may have higher socioeconomic status and therefore may have overall better health, maybe those that are selectively able to migrate. And this has been shown for substance use disorders. It's been shown for non-affective psychosis. And so it is, we see that maybe potentially in some specific populations, it could be shown for eating disorders. However, there is potential for bias. So for example, the SCOFF assessment has a specificity of around 80%. This could lead to a large amount of false positives, and that could be why we see the increase in prevalence. There are also some limitations. We weren't able to stratify by other subgroups, so maybe type of migrant or time since migration. And these are some things that should be further considered. This is the first systematic review on the topic, and further research is needed to delineate the effects of why we saw reduced prevalence in specific populations, and that could inform public health considerations. Here are my references. And of course, this project would not be possible without all the other members of my group and the professors from my class. Thank you all for listening.